Now, the CDC estimates more than 38 million Americans of all ages have diabetes, and it's a number that nurses say continues to increase. Now we're taking a look at how DRH Health is spreading awareness and helping to provide the best care to patients both in and outside of the hospital.
Diabetes. It's a chronic disease when a person's blood sugar is too high. And while it's common, diabetes educator Rachel Lloyd says many don't even know they have it,
because they're either not getting routine checks or they are ignoring the signs and symptoms,
including tiredness, frequent urination, excessive thirst, and even blurry vision.
Type 1 diabetes is an autoimmune, so they're genetically predispositioned to acquire it. It's where the body just quits making insulin altogether eventually. Type 2 diabetes, they are producing insulin, their body just cannot use it correctly.
She adds there's not one specific cause for the type 2. It could be genetic or even lifestyle. But ultimately, it's a multi-organ problem. And that's why early detection and intervention is critical.
Because by the time you are usually diagnosed with diabetes, you have already lost pancreatic function. And the pancreas is what produces insulin for the body.
She says the concern is complications due to individuals with diabetes not being able to heal as well. And adds the key is learning to manage diabetes. That's why DRH Health takes pride in its diabetes education program. The support group that meets monthly is certified through the American Diabetes Association and allows them to work with patients at all stages of their journey.
We meet the first Thursday of every month at 6 o'clock, and it's open to anyone who lives with someone with diabetes, who has diabetes, who has family members, who just wants to learn about it. They may have a new medication that they're introduced to, and we try and help them learn some of the best ways to use that, how it works.
Joy Galloway, who is a certified diabetes care and education specialist at DRH Health, says ultimately it's just letting patients know this is a journey they are not doing alone.
One of the most hopeful aspects of living with diabetes now is our new technology, all of the new medications. It's a very bright future for treatment with diabetes.
And a big focus is on continuous glucose monitors, or CGMs, and helping patients learn how to use them.
You can put them on and just look at them once a day, or you can put one on and look at it and use it to make decisions on, well, should I eat this meal? Is my blood sugar already too high? Maybe this is a good time to have a chef salad.
She says ultimately CGMs help diabetics see how successful the treatment is at keeping them on track instead of having to wait every 3 months to get an A1C drawn. Something that's important, especially as we approach more holiday parties where it's easy to overindulge.
Be sure and drink plenty of water. If you can, walk for 15 minutes after that meal. Those all help bring blood sugar back down to normal. Try and work on portion sizing. Nobody says that you can't enjoy the holidays. That's just human nature to want to partake with our friends and families with the foods that we've all grown up and loved.